We are already seeing flu shots offered at retail locations. Experts recommend getting it by the end of October. The combination of the pandemic surge and flu season is raising a lot of questions. Infectious disease specialist Dr. Joanne Passalacqua with Hartford Healthcare St. Vincent's Medical Center is joining us this morning with some answers. Thank you so much for your time this morning, Doctor.
Thank you. Good morning.
So with increase in COVID cases that we have been seeing, is it more important now than ever to get the flu shot?
Absolutely. You know, we had a light flu season last year, but I really believe that was because we were facing lockdown and, very strict regulations regarding the COVID-19 pandemic. But I think this season is going to be very different. You know, people are out and about again. They're back out dining, they're visiting theaters, they're shopping. All of that's wonderful. Life is coming back to normal. But with that comes much more risk of exposure to respiratory viruses, and particularly the flu.
Makes a lot of sense. I'm sure a lot of people are questioning whether to get the flu shot this year because we have been talking now about booster shots and people who may just be considering getting their first round even of the COVID vaccine, mixing those together. Is it safe? What can you tell us about that?
Well, certainly there's no contraindication to receiving your COVID booster shot and your flu shot at the same time. In general, I would say if people could space the doses of these vaccines by 10 to 14 days, that may provide a better immune response to each vaccine. But now more than ever, it's important to have a flu shot. The signs and symptoms of flu and the signs and symptoms of COVID essentially overlap one another.
Right.
So first off, if somebody gets the flu, it's very difficult to sort out whether they're suffering from flu or whether they're suffering from COVID. Of course, we have testing that will sort that out, but clinically, it would be difficult to sort that out. And I think the greatest worry for those of us in infectious diseases is the possibility that people may acquire both viruses, which would be a terribly deadly combination. So anything we can do to protect ourselves this season from respiratory virus, I think that's critical.
And right now there's a little bit of confusion as to who should get the booster now and who should wait.
Right. So the recommendation right now for people to get the booster is a very specific group of people with immune compromising conditions. These would be things like cancer patients going through chemotherapy, people with late stage or untreated HIV virus, people with organ transplants, or people taking certain types of immunosuppressive drugs. So I think if people have questions as to whether they fall into those categories, please reach out to your physician. But it's a very small segment of the population that would be boosting right now. In mid-September, however, we will begin boosting the entire population starting 8 months after people completed their second dose of one of those messenger RNA vaccines. So this would start in mid-September, and it would be for the entire population, anyone vaccinated with either the Pfizer or the Moderna vaccines.
Makes a lot of sense. So, Doctor, I guess we could say the main takeaway from our interview this morning is if you have not gotten your COVID-19 vaccine, do so, and do not be afraid to get the flu shot this season as well, because that is still just as important.
Absolutely. Absolutely. Vaccination is critical to putting an end to this pandemic.
And that is what we all want. Thank you so much for your time this morning. We appreciate it.
Thank you.